Hi, Glea. Thank you so much for being with us today. It's really a pleasure to have you as a part of our educational session for our grant recipients. So to everyone, Glea Timbol is a registered nurse. She is specialized in fertility, so she's a fertility nurse. And she's also the clinic manager at Tripod Fertility. That's how we met, because Tripod is the clinic that was created by the two founders of Fertility Friends Foundation, Dr. Roumain and Dr. Zineku. And it is a pleasure to have Glea part of this session today and hosting this session for all of you, because she has many different messages for you and talk about what is a fertility nurse and the role a fertility nurse has in a fertility journey, and for you to take advantage as much as possible of the resources that they offer. So thank you again, Glea, and welcome.
Thank you so much for this opportunity, Isabel. I'm honored to be able to speak to our grant recipients and offer some support wherever we can. Nursing is a special profession, and it's even more special that we're able to assist patients during this time of their journey. So I will start whenever you are ready with my presentation.
Thank you. Well, I think you can start.
Yes. So again, my name is Glea. I'm one of the nurses here at Tripod Fertility. My background is mainly fertility, and I also have background in mental health. That's where I started my career as a nurse. And so I always sort of operate or do my work in those lenses of mental health and fertility, which I believe represents a lot of the nurses. And so we'll start the presentation about fertility nursing and what we can support, how we can support you. Okay, so our objectives today is to understand the role of a fertility nurse in the clinic, learn how we can support you as patients on your journey through infertility. We'll also go over the IVF treatments, a little bit of education, and also share some resources for you to look at. So what is the role of a fertility nurse? I'm sure many of you are aware, as nurses play a huge part in your clinic experience. So a fertility nurse specializes in reproductive health and assists individuals or couples facing fertility challenges. Sometimes we are often referred to as reproductive nurses or IVF nurses. In terms of our background with school, we are certified either as registered practical nurses or registered nurses. And they're also a special group of nurses who have additional training and education, and they are the nurse practitioners, which are often called NPs. We are also known as the educators, advocates, counselors, and cheerleaders for our patients. We offer a combination of expertise, but also emotional care, which leaves a lasting impact on our patients. So the key responsibilities for nurses in a fertility clinic is we educate and empower patients through their fertility treatment. We assist in coordinating treatment cycles, relay instructions, and we collaborate with the fertility care team to enhance the outcomes. And that includes the doctors, the blood lab technicians, the ultrasound, and especially the embryology lab. We also support patients as they navigate the often complex and emotional path towards starting a family. And we provide clinical care to patients undergoing fertility procedures like egg retrievals. Okay, now we'll do a little IVF process overview. Of course, for a purpose of time, we won't be able to dive deep into each part of the IVF process, but I trust that your individual clinics will be able to support you through an education session to walk you through this from start to finish of an IVF cycle. Okay, so before you start an IVF cycle, typically there are baseline testing that are completed, which includes infection screening and ultrasound. It also includes a session with your team, your nursing team mostly, to go over the process specific to your clinic. and most especially the medication teaching. We also take the time to provide you with information session so that you can sign consents and any questions you have are answered. Once you begin your period, or if you know period, once you are assigned a start of a cycle, you will be taking injectable medications to recruit and grow more than one follicle. And this typically takes about 10 to 14 days. The timeline is based on the individual's response to the medication and when their follicles in their ovaries are ready. To be able to determine when you're ready, the doctor will order or ask you to complete hormone blood tests and vaginal ultrasounds or abdominal ultrasound scans. And this is often called cycle monitoring. And this is to assess your progress while you're taking the injections during the 2 weeks. Typically about 4 to 8 visits during your cycle that you'll be going into your clinic for blood and ultrasound. And once the follicles in your ovaries reach an optimal size and number, then you'll be ready for the egg retrieval. When you are ready, the doctor will instruct you to take trigger injection, which is a one-time injection that stimulates the final maturation of the eggs within the follicles in your ovaries. The specific time is really dependent on your history. This is clinic specific, so it's very important to follow the protocol provided to you. And this is often relayed to you by the nursing team in your clinic. Oftentimes, it's between 35 to 37 hours before your scheduled egg retrieval when you take your last injection, which is the trigger shot. The next phase of the IVF cycle, so the 2 weeks after the initial, that's when we proceed with the egg retrieval procedure, and that happens in an operating room setting. Under ultrasound guidance, a needle is inserted and your ovaries are accessed through the needle. The eggs are then obtained using a pump to be able to go into the lab and look under a microscope to check for any eggs. Oftentimes, conscious or deep sedation is provided to ensure that the patient remains comfortable during the procedure. It takes typically about 15 to 30 minutes during the procedure, and recovery time really depends on how you feel, but we expect that you're able to resume back to normal activities the next day. The secondary part of an IVF cycle is the sperm sample. The sample can be collected from various sources, which can be a planned, fresh, or frozen sperm source, or a sperm retrieval can be done. Abstinence period will be advised for the sperm source to optimize the quality of the sample. Once the sperm and eggs are retrieved, then the embryology lab does their procedures in the lab to basically add the sperm with the egg. There's 2 different ways to do this. There's the conventional insemination, or individual sperm is injected directly into a mature egg called ICSI, or intracytoplasmic sperm injection. So this happens on the day of the egg retrieval. Then the eggs are placed in an incubator and they will remain there for further development, where they will fertilize and grow into fully developed embryos, typically for about 5 to 6 days. It is important to remember that not all eggs will fertilize and not all embryos will develop to be frozen. So we like to prepare patients to hope for the best, but also prepare for unfortunate news. But it's important to be prepared for both, but we certainly hope that it will be a successful procedure. Genetic testing is an option, often called PGTA or sometimes PGTM, and it can be completed by taking a small sample of cells for analysis and sent to a genetics lab for testing. Either a few days after the retrieval or in another cycle, embryo transfer will occur, wherein the embryo will be placed back into the uterus, whether it's the intended parent or the surrogate in this case, for hopefully a successful pregnancy that we'll find out 2 weeks later. Okay, so that's a snapshot of an IVF cycle. Third-party reproduction, so just touch base on a third party. So oftentimes this is referring to donor and surrogacy cycles. There are different family building options for patients, for single individuals, heterosexual couples, individuals and couples from the LGBTQ community. There's options for using donor eggs, donor sperm. There's something called reciprocal IVF, embryo donation, and gestational surrogacy. So I'm quoting the Resolve website. Family comes in many forms, and everyone's path to parenthood is uniquely different. No matter those differences, anyone who struggles to build a family should have equal access to whatever option they choose, including the LGBTQ plus community. So I know that the foundation has a dedicated grant for this community, and that is really special. And I'd like to share some resources for you. So some fertility information for patients. There are a lot of patient-specific resources from the American Society of Reproductive Medicine, the Canadian Fertility and Andrology Society, Resolve also. There's something called SART. The last point here, which is Assisted Human Reproduction Act, is the Health Canada guidelines on how, especially when it comes to third-party reproduction and use of sperm and egg gametes. So these are good information. There's a lot of information out there. These are reputable sources. And I also recommend that you ask your fertility nurses for further guidance if you need more information. As I mentioned earlier, the nurses are also your coaches or counselors and your cheerleaders, and oftentimes not just looking at the medical side of care, but also the emotional side or the mental health side of care. Important to know that you have support through different organizations if you need for additional emotional support through the ups and downs of fertility journey. So some that I've added here is from Fertility Matters Canada. There's a list of counselors who specialize in fertility, who are able to provide you individual counseling, couple, or family members. Canadian Mental Health Association also provides an innovative learning space where anyone can access free courses, webinars, workshops, or events to support their personal recovery and mental health and sort of that type of well-being. Baby's Breath Canada is a national organization for infant loss. They provide support, encouragement, and education. So it's important to know that you don't have to go through this alone. You have the support of your clinic, your family, the foundation, and also organizations such as these listed here if you need more support. That's the end of my presentation.
Thank you so much, Glea. It was wonderful actually to have an overview of what a fertility nurse, what kind of resources and what support a fertility nurse can provide to fertility patients. And I'm sure it's always helpful, even though we think we know what's, especially as a patient, what our nurses can do for us. I think it's great to really have the global overview of what support they can provide. So thank you very, very much. And we can start the Q&A. Oh, thank you.
Yeah, I just want to say a heartfelt thank you to the foundation, to Isabel, for this incredible opportunity. And I'm glad and honored to be part of it. And thank you for your dedication to supporting patients through their fertility journey, and now Canada-wide, which is great.
Thank you. Thank you so much. Thank you.